Hey guys, Swen Sandberg, physical therapist with YADAYADA. And if you have neck pain, you're not alone. Did you know that there's 288 million people worldwide who have neck pain at this very moment? And did you know that in your lifetime, it's expected that you'll have the likelihood of having neck pain between 22 and 70%? That's a lot. I mean, let me be the first to welcome you to the club. Neck pain's a problem. And it's such a big problem, we're even creating new terms like text neck to describe it. So for all you guys who are part of this not so exclusive club, I've got a 4-step strategy to help you reduce and prevent your neck pain. All right, so before we get into the strategy, what we need to establish here first is what is causing your pain. And what's most likely is your forward head and hunched shoulder posture. And we all adopt these postures. Over time, this posture creates pain, creates muscle tension, creates headaches, and if you adopt it for many years, it creates osteoarthritis. A really horrifying fact about forward head posture that I learned way back in physical therapy school was that for about every additional inch of forward head posture that we adopt, we're adding 10 extra pounds of strain to our neck. So if I adopt a posture like this, and I do that for a few hours, I've essentially added 40 to 60 extra pounds of strain. This forward head posture is miserable, okay? And that's what usually causes neck pain in the majority of people. So to counteract this forward head and hunched shoulder posture, we need to address 4 things. The first thing, we need to address posture. The second thing, we need to reverse the strain that you've created in your neck and on your spine. And we can usually do this with a few simple exercises. Thirdly, we need to restore flexibility to the surrounding muscles. And lastly, we need to build some strength in the muscle groups surrounding your neck and in your mid-back. All right, so let's get into the 4-step strategy. Now, the first thing we want to do is work on posture. And I'm a huge fan of a rolled up towel. It's cheap, it's easy, we all have them. That's the best way to fix your posture. Now, a towel that's thin like this, and you can see we've wrapped it in a little bit of Coban to keep it there, is probably your best bet. Your big fluffy towels at home, probably too much posture correction, probably not gonna be as comfortable. So get your cheap worn out towels out and roll them up, okay? So the first thing you're gonna do is, in order for this to get better, we gotta fix it, right? We can't stay here all day and do a few exercises and expect it to feel better. So the first thing you're gonna do is you're gonna scoot your bum back, and you wanna be almost literally sitting on the backrest. You can tell already that this has fixed my posture to a great degree, right? Just sitting like this has taken me from here to here. Putting the towel in the lower kind of small of your back, and then just sitting up against the towel, not over it, just against it, brings that really nice posture. My ears lined up with my shoulder. I don't have a big forward head posture anymore. And this is fairly comfortable. For a lot of people with neck pain, putting the towel between the shoulder blades is even more comfortable. And I would recommend this, especially if you have severe neck pain. This tends to feel really nice, and it resets that mid-back and brings that forward head, again, back to its neutral position. So that's the first step, gotta fix that posture. From here, you can even leave the towel roll there. Now we need to reverse the strain from a forward head posture, okay? And in order to do that, we're gonna do 3 simple exercises. The first one is a chin tuck. Now you can see I'm pulling that chin straight back, and I'm gonna show you that from the front as well. So with the chin tuck, you wanna be coming straight back. Chest is allowed to elevate or rise. You don't want to be nodding your head down. I find that most of my patients do this the first few times. We really want to be going straight back, okay? And don't be looking up and trying to do this either, okay? Now I recommend that the first time you do this, you look in the mirror and you make sure you're going straight back. That's the best teaching tool you have. Okay, that's exercise number 1, and it's called a chin tuck. I recommend that you do that 10 times, and I would do it every 2 to 3 hours, especially if you're working at a desk, okay? The next exercise is called cervical retraction to extension. So what you're gonna do is you're gonna still use that nice little chin tuck, You're gonna slightly tuck your chin this time, not all the way back, just slightly. And then you're gonna let your head fall back. And then return. Now, you're gonna wanna let your head fall back as far as it's gonna go. And each time you do this, try to make your head fall back a little bit farther. You should feel a stress right here at your lower neck. And when you're done, that stress should go away. Again, I would recommend that you repeat this 10 times and that you do it about every 2 to 3 or 4 hours a day. All right, the last exercise, lo and behold, your towel comes back into play. You're gonna take the towel, I'm gonna turn the chair again. You're gonna take that towel, you're gonna scoot all the way back. You're gonna put that towel horizontal across your spine and put it up high, maybe just below the shoulder blades. You're gonna put your hands behind your head. This also stretches out the pecs, which is also a problem with forward head and hunched posture. These tighten up, so this is a nice dual exercise. And what you're gonna do is you're gonna lean back over that towel, opening up your chest, allowing your arms to fall backwards and look up. And you should feel quite a bit of stress right here in your back, okay? Again, I'd recommend that you do that 10 times. And I'd recommend that maybe you do that one 2 or 3 times a day, okay? That'll help really loosen up your thoracic spine and allow you to pull your head back, okay? The next thing we're gonna do is we need to work on flexibility, okay? When we assume this posture, muscles like the upper trap, the sternocleidomastoid, the levator, which runs from here to the top of your shoulder blade, they all get tight. And so we want to loosen these muscles up, okay? A lot of times people complain that they feel like a knot in their muscle, and this should help that. The first one is an upper trap stretch. So we're going to stretch this muscle here, okay? Now again, you can use the towel roll, put it behind you, sit in good posture. I'm going to sit at the edge of the chair. And the first thing you're going to do, again, sit up in a nice good posture. You're going to take your hand, you're going to place your fingers on the opposite side of your head. You're gonna grab the chair, okay? That keeps this shoulder down. Then you're gonna tip your head away from the arm that's holding the chair. And then you're gonna tip your head and rotate it slightly towards your armpit and look slightly down, okay? You're gonna hold this position for 30 seconds. And you're gonna wanna repeat this 3 times, both sides. The stretch should be felt here. So if you're not feeling the stretch there, you're either going to pull your head forward more, or you might want to try just rotating a little bit more towards the armpit, or maybe even away from the armpit and test it out that way, okay? The next stretch will be the Levator Stretch. It's the same setup. I'll do it the opposite side this time. You're going to grab the chair. You're going to put your elbow right in front of your face, and I'm grabbing my head like this. You're going to pull forward very lightly. Stretching does not need to be done aggressively. You're going to look at the hip of the arm that's pulling. So I'm looking right here at my hip. And I'm going to kind of sniff my own armpit, right? It's kind of disgusting, but I did wear deodorant today, so I'm pretty good. And I'm just going to hold that position till I feel the stretch right through here. Again, hold that for 30 seconds. And repeat that 3 times. Of course, do both sides. The last stretch that you're going to do is a sternocleidomastoid stretch and a scalene stretch. And you can do them both basically at the same time. You're going to take your hand and you're going to place it right over the collarbone, okay? And I'm going to push down in that kind of soft spot just above my collarbone. And then I'm going to look straight up. And again, I would recommend holding on to the chair. I mean, you don't have to, but I think it's nice. You're gonna look up, and then you're gonna tip your head away from the hand here, and then you're gonna rotate your chin back towards the hand on your collarbone. You should be feeling the stretch right here. Now, to stretch the scalenes, all you have to do is rotate your chin away, okay, from the hand. And again, I'd recommend that you do that 30 seconds, 3 times, a couple times a day. Okay, so the last step is now strengthening. So what we're going to want to focus on is strength here in our neck stabilizers and strength back here, okay? Now, that chin tuck is going to come back into play again. The very first exercise we did in this strategy. So you're going to do a chin tuck, but this time you're going to resist the chin tuck with your arms. Now you can use one hand or you can use both. I like to use both. I'm going to tuck the chin and then I'm going to push forward with my arms, okay? So where I feel that is right here and then down into my mid back. We want to strengthen those muscles. It's also strengthening these muscles as well. And plus it feels good. It's a nice reset to that nasty posture that's causing all your pain. Okay, you're going to want to repeat this 10 times. And I would recommend 2 or 3 sets. But if you're running short on time, maybe just do it a couple times a day, 10 reps. Okay? Now for the next 2 exercises, you're going to either want to lay on the floor or on your bed. Now I prefer off the edge of the bed, but laying on the floor works just as well, and some people definitely prefer that position. So let me show you the last 2 exercises. They are called a prone Y and a prone T. Okay, so for these last 2 exercises, you can use your rolled up towel. The towel's becoming pretty handy, right? And you'll place your forehead on that towel, and then you're going to bring your arms to the side. Now if you're laying on your bed or the floor, your hands are basically going to stop here, right? Because I'm laying on this short table, I can bring them down here. And again, that chin tuck is not going away, so you're going to slightly tuck your chin, just so my head is barely off the towel. And I'm going to squeeze my shoulder blades, thumbs are up towards the ceiling, and I'm going to lift my arms, okay? And then I'm going to come back down. And I'm going to repeat that 10 times. Ideally, I would do 3 sets of 10, okay? The last exercise is that prone Y. You're going to want to assume a position with your arms at about 45 degrees. Your thumbs are up to the ceiling. Again, lift your head slightly off the towel and lift your arms. And again, I'd repeat that 10 times, 3 sets. All right, so for this strategy to be most effective, we need to structure it into your day-to-day routine. So I want to give you a little advice on that. First thing, I would highly recommend that if you're going to work or you're going to sit in a static position for a while, that you immediately fix your posture. Again, remember, scoot your bum all the way back, and the towel's your friend. Put the towel back there, either on the small of your back or between the shoulder blades. Next, those exercises that help reverse the strain from a forward head posture, that chin tuck, the cervical retraction to extension, and the seated thoracic extension, should all be done periodically throughout the day. This helps reset your posture, helps reduce the strain, okay? Now with the flexibility exercises, the trap stretch, the levator stretch, and the scalene and sternocleidomastoid stretch, I'd recommend that you do these stretches maybe on your lunch break or midday, and then maybe again right before dinner. I find that most of my patients do better with that kind of schedule than trying to stretch in the morning or really late at night. And then lastly, with the strengthening, I would recommend that you perform the strengthening either in the morning with your regular exercise routine or maybe in the evening. Now there are some benefits to doing it in the evening, as it will help to reset some of the strain that's been on your neck and upper back during the day. I'd also recommend that you perform a pole exercise routine. Stay tuned, we're probably going to make a video on it. But for now, if you want to Google pole strengthening routine, you're going to find a lot of really good ideas on YouTube and on the web, okay? As always, if your neck pain is not improving or your neck pain is getting worse, please seek the advice of a qualified medical healthcare practitioner, and good luck.